Peyronie's disease, the curved penis, non-surgical treatment options, intralesional injections, intralesional collagenase Clostridium histolyticum or Xiaflex. Xiaflex is a prescription medication used to treat adult men with Peyronie's disease, characterized by an abnormally curved penis and a palpable plaque. It is a combination of bacterial collagenases designed for two specific conditions: the treatment of adult patients with Dupuytren's contracture who have a palpable cord, and the treatment of adult men with Peyronie's disease who have a palpable plaque and a curvature deformity of at least 30 degrees at the beginning of therapy. Xiaflex should only be administered by a healthcare provider experienced in treating male urological conditions. Xiaflex is indicated for stable Peyronie disease, penile curvature between 30 and 90 degrees, and intact erectile function. Important information before treatment. Xiaflex treatment is designed for penile curvatures directed upward, dorsal, or to the left/right, lateral. It can be used off-label for downward, ventral curvatures. While receiving Xiaflex treatment, you should avoid medications that thin the blood. Taking these medications can result in severe bleeding under the skin of the penis. Xiaflex is not indicated to improve other deformities, calcified plaque, relieve pain associated with Peyronie's disease, or improve erectile function. Before starting treatment, a curvature assessment is required. This involves a sonogram of the penis to determine the location of the curvature. What to expect during the procedure? You will undress from the waist down and lie on an exam table for treatment. First, we will identify the point of maximum curvature based on the curvature assessment results. This area will be marked and cleaned. A small amount of medication will then be injected into the penis at the site of curvature or indentation using a thin needle. Most men report feeling the needle and then a warm sensation during the injection. The goal is to inject the medication into the middle of the plaque to soften it and reduce the curvature. After the injection is completed, the nurse will apply firm pressure, and a bandage will be wrapped around the length of the penis, leaving an opening for urination. This bandage helps decrease bruising and swelling, but does not improve the curvature. You should wear the bandage for 24 hours and should not re-wrap it if it slips off. Aftercare instructions. 1. You have no restrictions on daily activities and may return to work as you feel able. 2. Cover the dressing with a plastic bag if you need a shower. However, you may prefer to wait until the dressing is removed the day after treatment. 3. You're cleared for sexual intercourse, oral sex, or masturbation after 2 weeks of the last injection. 4. Traction is an essential step to maximize the results of this treatment. Begin using a traction device 1 or 2 weeks after the last injection of each cycle. Insurance coverage. Xiaflex can be expensive, so obtaining approval from your insurance company before starting treatment is essential. Our office can assist you in completing this process. Xiaflex injection schedule. The initial treatment course involves 4 injections divided into 2 cycles with 2 injections each. After this, a follow-up sonogram will be performed to assess any improvements in curvature. If improvement is noted, you will proceed with 4 additional injections and a final sonogram. During the intervals between injections, it's crucial to use a penile traction device or vacuum device at home to help reduce curvature. To minimize the risk of penile fracture, it is strongly recommended that you avoid sexual intercourse, oral sex, or masturbation for 2 weeks after the last injection of each cycle. Xiaflex is effective in 60% to 70% of patients, showing a curvature reduction of up to 20 degrees or as much as 40%. Apparently, a higher baseline curvature before the procedure increases the possibility of responding to the treatment. Common side effects. After the injection, you may experience some common side effects, including penile pain, bruising, swelling, and hematoma. The swelling of the penis and bruising in the surrounding area can vary after each injection. It's important to note that these reactions do not necessarily indicate that the plaque is being treated. Some patients may have minimal swelling and bruising, yet experience significant changes in the plaque size during their next visit. Conversely, others may have severe swelling and bruising with no change in the plaque. Pain at the injection site is also common, and you may feel soreness for up to 7 days following the procedure. Additionally, there are potential complications to be aware of, including corporal rupture, penile fracture, and skin necrosis, which may require surgical intervention. No surgical treatments are available for patients with Peyronie's disease. Xiaflex is a treatment option to improve penile curvature.